So welcome back, guys. I'm sorry about the interruption. So we were talking about chronic obstructive pulmonary disease. How's it defined? Well, it's a long-term progressive. So progressive, that's not just the name of an insurance company. Progressive means something has happened, and in time, it's just going to progress. It's just going to get worse. So it's a progressive condition, so it's just going to get worse, in which airflow is limited by an abnormal inflammatory response. It's irreversible. So we have certain conditions, there are certain conditions in medicine that are reversible. There are some things like if you're taking a drug, for example, a statin. What's the unusual black box warning about a statin? What's a statin used for? Cholesterol, you got it. When you take your statin pill once a day at bedtime, why? Because you make your cholesterol at night. And what do we avoid when we take our cholesterol pill? Grapefruit juice, either an hour before or 2 hours after. But with the statin drugs, they are extraordinary. They're so effective at reducing our calorie as far as raising the HDL, the high. That's the one time when being high is great. You raise the HDL, the high LDL, you lower the LDL, the low density lipoproteins. And so you end up, in the end, reducing the atherosclerosis or hardening of the arteries. So that's a very good thing. It's such a good thing that most insurance companies even have a zero copay. They want every single patient to be on a statin because in the long run, it saves them money. Well, anyhow, with the statin drugs, a certain percent of people, when they take it, they develop rhabdomyolysis. Rhabdomyolysis is a rapid deterioration of the muscle tissue. And the problem is when you're breaking down the muscle tissue, there are just pieces and metabolites that build up and they're extremely painful. And so usually it's noticed, they just define it as a soreness. But I even experienced it personally, a very severe soreness, and I even felt it in my finger muscles. And I stopped taking the drug, and within just a few days, it was completely gone. So that's reversible. But when you have an irreversible condition, that means the damage has been done, and they cannot undo it. They're not able to use Drano. They're not able to go in with a pipe cleaner. So when you've got this damage that's done to your bronchioles, it's permanent, and then it's only going to get worse over time, even with treatment. What are the risk factors? Well, there is a genetic predisposition, and it's higher in males than females, but it's also higher, and guess what? It's higher in African Americans. Next is in Hispanic, and then white or Caucasian. Smoking. Now that's something. I will tell you guys, I smoked when I was your age. It was cool. I enjoyed it. Well, I don't know, but I just did it. And so I understand why people smoke. But as you get older, you realize, let me just put it this way. How many of you would like to have a brand new, you just think of whatever car is your dream vehicle. And if you got a 2020 dream vehicle, would you put the cheapest quality oil you'd put in it to whenever you're changing the oil? Would you just forget about changing the oil, that filter, air filter, maybe just change it once every 5 years? Or what about the gasoline? Would you be putting the best gasoline you can afford, or would you put the cheapest you can find? No, you would take care of that vehicle because, like it was the baby Jesus, you would want to enjoy it and keep it in as fine of condition as possible. You'd think that's what people would want for their own bodies. But some of you are probably vaping and smoking while you're watching this. So I'm just trying to appeal to you to think about that, because smoking, if you see a lung of somebody that's smoked even just 1 pack a day, most people smoke an average of 2 packs a day, but 1 pack a day just for 10 years coats over 1/3 of your lung bronchioles with tar. Exposure to pollution or occupational hazards. Well, unfortunately, we all live in Houston, the Houston area, we have these petroleum plants. It's not as bad as other parts of the country, but there are days if you walk outside. I live in Deer Park. There's Shell has a refinery, and you can literally walk outside and watch birds flying above the Shell refinery and just dropping out of the sky from whatever gases are being emitted. And to think people that are working there, they're making good pay, but what's the exchange? And then also, like coal miners, people that work in situations where they're not getting quality oxygen and instead they're breathing in things that are damaging their lungs. Then repeated respiratory infections. So emphysema is destruction of the alveoli, or the air sacs. So you have your bronchial, and then you have these little air sacs at the end. Now look at these, destroyed. This is normal, this is destroyed. Which would you like to choose if you had a choice? Now, what if you found out your choice depended on whether you got to enjoy vaping or not, or even smoking marijuana or not? The damage is catastrophic. And it's one of these things where our bodies have so many backup and reserve systems, the homeostasis, we're able to get by for a very long time, but it will eventually catch up with you. Now, bronchitis. Itis is, y'all learned this in career prep, inflammation. And the bronchi is the bronchioles. Inflammation of the lining of the bronchial airways. Acute bronchitis is caused by a viral infection. So it's very, very common for you to get bronchitis. Bronchitis is just whenever you're fighting a viral infection, and the virus, it thrives on the lining and the mucosa of the bronchioles, and that's where the action's all taking place. So you get inflammation, and so that's as close as it's going to come, just based on an infection. Chronic bronchitis is defined as excessive production of tracheal bronchial mucus. So tracheal, that just is higher up. It's in the esophagus area. And so I guess a less medical term for mucus is snot. But nobody likes to just be choking on just gobs and gobs and gobs, prolific amounts of mucus. But your body's capable of making this mucus in response to either an infection or to inflammation or irritation. So what is the treatment for COPD? What's the word empiric mean? Empiric means that's when you go to a doctor, and before he has the advantage of having lab work and x-rays and knowing your medical history, he's just basing his treatment on what was taught in school and based on just the average general person. What is your normal approach just for everybody? And that's beta agonists. So those beta agonists, they stimulate the beta 2 receptors. Those relax your bronchioles so you can get a better perfusion of oxygen. Anticholinergics. Now, why would we use an anticholinergic? What do anticholinergics do? Anti-slud, salivation. So you're not making saliva. It causes dry mouth. Lacrimation, you're not teary-eyed. It's drying your eyes. Constipation and interferes with the urination. Anticholinergics are they're powerful drying agents. That even applies to the mucus production. So it dries up your mucus production so you have less mucus that you're creating, generating, and swallowing. Corticosteroids. Now, corticosteroids, they're just like a magic medicine. They come with a price. So if you could take oral corticosteroids indefinitely, that would be great. The problem is there's side effects. One side effect is significant weight gain, but the most serious is that it compromises your immune system. So we try to limit the corticosteroids to the ones that are used either nasally or in inhalation. That way the corticosteroids, where they work, is just topically. They don't really get absorbed systemically, so you don't get as much of the side effect as you would as if you were getting an injection or taking them orally. Then the methylxanthines, so that's the theophylline. Remember, theophylline, it's like coffee. And as you know, coffee, if you drink enough coffee, it actually has a similar action to theophylline. Oxygen. So what do you do whenever somebody's oxygen saturation is low? Well, you just increase the amount of oxygen they're being exposed to. Physical therapy. So physical therapy, moving your muscles, using your muscles, that's going to build up your strength, your muscular strength, the strength you have in your diaphragm. It's going to give you more of a fighting chance, just helping strengthen your body's own system to try to utilize its own resources. Antibiotics are very important, especially because whether you have an infection or not, when you do get an infection, if you have COPD, it's just so much worse. Expectorant. An expectorant, what is that? Well, to expectorate means to expel. And an expectorant, in terms of medicine, that's a medicine that helps you to have a productive cough. So when you have real thick phlegm or mucus or sinus drainage, and sometimes you've heard people when they snarl and snort and then hack something up. Well, an expectorant just helps make that process less difficult. In other words, your mucus is thinner, so whenever you do cough, it's more likely to come up, it's easier to come up, and it's easier to get out of your system. Then vaccinations. And where the vaccinations come into play, if somebody has COPD or emphysema, their lungs are already compromised. So they're already fighting an uphill battle, and they've already got inflammation. If you get a flu, then it's just going to be that much more difficult for the person with COPD. If you get pneumonia, now pneumonia is a secondary infection. You have to get an infection first, and then when your body's vulnerable, then you're exposed to the pneumonia and you can develop the secondary infection. They recommend that people over 65 get the pneumonia vaccine, and that's just because it's better to at least get the vaccine and hopefully prevent your potential to develop pneumonia than to develop pneumonia, because especially if with COPD or emphysema, over 70% of people that get pneumonia that have COPD or emphysema end up on a ventilator. You've heard a lot about ventilators with the COVID-19. Ventilators, on the surface, when people hear about this respiratory infection or condition, and it's so serious and people aren't getting enough oxygen, they just need a ventilator. Well, a ventilator, it's actually a very serious machine. And one of the biggest problems they have is now we have enough ventilators, we mass produced them, but you need experts. There are people that train for years because you have to sedate a person. You have to give them a cholinergic product that paralyzes their muscles so that you can shove tubes down their throat and into their lungs. You have to keep them practically in a medically induced coma because it's the body's normal instinct to want to pull those tubes out. Even when somebody is not even alert, when they're just unconscious, their body's going to want to try to pull the tubes out. So they have to be heavily medicated, almost put into a subconscious or an unconscious state. So the ventilators, actually, I believe I saw the most recent statistic was that out of for every 10 people they put on a ventilator, only 3 survived. Of the 7 out of 10 die. Of the 3% that survive, now they're finding all kinds of horrible after effects. People are having PTSD, hallucinations, strokes. So the people that went on ventilators, there's just some problems that are going to unfold. We'll find out more information as time goes on. But you want to try to avoid that if possible. And so antibiotics, well, those are good for fighting an infection when you're infected. Expectorants help thin the mucus, prevent. The more mucus you have, mucus is a perfect growing medium for infections. So how do you treat COPD? The anticholinergics, they inhibit acetylcholine, which stimulates smooth muscle in the lungs to constrict. More importantly, though, by stimulating the muscarinic receptors, you have those the cholinergic, or what they call anticholinergic side effects. And the blurred vision, well, that's just because it dries out your eyes. There's no lubrication. It can cause your heart to race, tachycardia, which results in palpitations. Your heart's just beating a little bit too fast. Dry mouth, most common is dry mouth. Here are some of the anticholinergics, and I just want you to look at like atropine. Do you see A-T-R-O-P? Atropine is anticholinergic. And so if you look at the 2 most common are Atrovent, which is ipratropium, but you see atropine, A-T-R-O-P-I. And then we have tiotropium. tropim. So there's your atropine, Spiriva, and Atrovent. These are long-acting, and so another word for the anticholinergic or cholinergic receptors is muscarinic. And so these are just some examples of some of the inhalers. And believe me, this one right here is $600. Then we've got the long-acting beta agonists. Now with the long-acting beta agonists, these are drugs, they're used around the clock. If it says use twice a day, you use it twice a day, you use it every day, every 12 hours. It does increase your risk of asthma-related death, and there's not really certain of the correlation, but in part it's because they're beta-2 agonists, but sometimes they have a little bit of beta-1 activity which stimulates your heart to race. So these are examples of the long-acting. So we got formoterol. Ceravent's the one that's the most common. And this one is a MDI, so it's a meter dose inhaler. This one is one that's the Respiclick. It has the little powder capsules. So long-acting beta agonists. So we've got, let's see, there's the Ceravent. This one's probably the very, very most common. So it's salmeterol. Then we have, but you'll see there's just, and these are Me Too drugs. The Me Too drugs, that just means all somebody did was they come in and slightly modify the molecule, make it a little bit different. It does virtually the same thing, and then they come out and try to get a piece of the pie from the people that are suffering from the condition. But if you look at the TERO, so I don't know, still the Tutorol, it's the beta 2 and the tutor, like the Tutorol beta 2, and these are the long acting. So what are the main classes of medications used to treat COPD? Anticholinergics and the long-acting beta agonists. How do we deliver this medicine? We have the meter dose inhalers, dry powder inhaler, or the nebulizer solution. Other therapies, we have phosphodiesterase 4 inhibitors. This is whenever you start getting to patients that are resistant to the benefits of steroids, long-acting, and the anticholinergics. Mucolytics. A mucolytic breaks up mucus. And so one thing that's very interesting, acetylcysteine. This is a drug, it's used, there's a medical condition called cystic fibrosis. It's a condition of the exocrine glands. And what happens is patients, they just make too much, they stimulate too many solutions. So they make too much mucus, they make too much saliva. And so but with the mucus, they have to break up that mucus, and so they use the acetylcysteine. One thing they discovered though, acetylcysteine enables the liver, what it does is it prevents liver from building up and destroying the liver. So as long as if somebody does have an overdose of Tylenol, especially if it's an intentional suicide attempt, as long as it's caught within 72 hours, it can be completely reversed. And they use acetylcysteine, and the brand name is Mucomyst. Then we have combination products. What's a combination product? Once again, many times when you see combination products, it just means that something lost its patent exclusivity. And so a drug company just combines two drugs and comes out with another new brand name product. And then how do they promote it? Well, they tell the doctor, well, a patient's more likely going to be willing to use one inhaler that's got two medicines versus having to use two inhalers. And keep in mind, with the inhalers, there's pharmacists will explain to the patients, the doctors, the respiratory therapists, but there's an order and there is a method to the madness with using inhalers. If you're using a short-acting beta agonist, you're going to use it, 1 or 2 puffs. You're going to wait 5 minutes. You're waiting for those bronchioles to relax. Then you can use your steroid or your anticholinergic. Why do you use it then? Well, because the steroid is going to help reduce inflammation, but you're going to have much better penetration into the bronchioles when they're relaxed. Here are some of the combinations. Now, the one that's going to be the most common that you see is going to be Advair. Advair HFA, that's going to be one of those MDIs. Advair discus, that's just the little capsules that puncture. So we also have Symbicort, but the most common one, it's purple. And what this company did that was very, very smart, they had a newspaper advertisement, and this is back just slightly before everything just went online or through the iPhones. But they every Sunday they had a free ad where you could get a 6 months of Advair for free. And so even if somebody had insurance and a copay, they were paying $35 or $50 a month. So to get it for free for 6 months, they would get this coupon, redeem it, have their doctor write it. Then once they got placed on it, they'd stay on it. Ipratropium albuterol. So albuterol is a short-acting beta agonist, but the ipratropium is anticholinergic. This one now we actually have, they came out with one thing I like about this company, they have a training device. And so we have several of the Combivent Respimat training inhalers. And I want y'all to see that when we do get back to the classroom, because it's pretty interesting how they work. Students, they'll see the brochure, they'll look at it, but the minute you get to handle it and twist it and see how it works, is, oh, wow, this is pretty cool. So this is the long-acting beta agonist, and then where it says LAMA, that's really muscarinic, but it's the anticholinergics. So these are just combining long-acting beta agonist, so TEROL, so TEROL, TEROL, and then you're going to see the anticholinergic. And so they'll either end in peronium, NIUM, or they're going to have ATROP. This is long-acting beta agonist with inhaled corticosteroids. So you'll see the terols. So you got formoterol, fluticasone. So remember hydrocortisone, prednisone. Those are steroids. They end in sone. And then betamethasone, SONE, fluticasone. And then we have the budesonide. So this is just a long-acting beta agonist with the inhaled corticosteroid. And that just means instead of having to have 2 inhalers, you got 1 inhaler. Then Aceratide, what they did, Advair had their such a successful campaign, and they were famous for having their purple discus. So guess what? They came out with one, and they called it lavender. Other lung diseases, well, we've got pneumonia. And pneumonia happens in the lower respiratory tract, and you can't just develop pneumonia. You have to have a primary infection first, then you get pneumonia. Aspiration pneumonia, that's whenever you actually happen to get fluid that ends up from the mouth or throat. The fluid ends up in the lower respiratory tract. Community acquired, this is the most common. This just means that it's the type of pneumonia you can get outside of a hospital. So the community acquired of the pneumonias is the most treatable. Then the word nosocomial. Nosocomial is a word that means it's a pneumonia that somebody developed while they were in the hospital or in an institution. These are usually very, very difficult to treat. And it's also a very bad indicator for a hospital. They have to report every incident of a nosocomial pneumonia. So for example, if you went into the hospital and have your tonsils removed, but then you end up in intensive care with a nosocomial pneumonia, that means somebody did not follow the sterilization procedures properly or aseptic technique. Tuberculosis is caused by Mycobacterium tuberculosis, and it's most commonly, it manifests in the lungs. It's seen in alcoholics, prisoners, people that have compromised immune systems, especially with HIV, older adults. Symptoms are weight loss, blood in the sputum. So if you cough and there's blood in your sputum, that's when it's time to go see a doctor. Night sweats, fever, and for some reason it happens to just peak at night. Chest pain and malaise. Malaise is a word that just means you feel bad all over. So how do we test for tuberculosis? There's a skin test that's injected intradermally, and they check within 48 to 72 hours to see if there's an elevation. If there's an elevation, your body's having a response to the purified protein derivative, which is a positive indication. But that doesn't mean you have tuberculosis. They have to follow it up with an X-ray. So if somebody does test PPD or positive, the next step, they do a chest x-ray, then they can confirm if you have tuberculosis or not. The reason it's so important is the moment you're identified with tuberculosis, they put you on medications to treat the tuberculosis, but also to make sure that you're not going to be exposing others. One of the biggest problems we have with tuberculosis is multi-drug resistance. Why? It's because we have such non-compliance. There's a lot of third world countries where getting medication is very difficult. And so people will develop tuberculosis and then maybe get one drug or some drug or maybe a combination, but just not enough. And whenever you do that, whenever you take just part of a therapy, or if you just take one drug, but you really need to be taking 3 drugs, all you're doing is making the infection you have resistant, more resistant to treatment once you do treat it with the correct medications. It can take up to 2 years of treatment. The obstacles, there's side effects. Well, for example, rifampin causes you to have orange tears. Back in the day, with contacts from now, you can just buy disposable contacts, but there was a time when you couldn't. And so if somebody had to take rifampin and they wore contacts, it would turn their contacts orange. And then everything they saw when they looked through their contacts would be orange tinted. The other thing is people get tired. If you think you're tired of this lecture, just imagine something that you have to do for 2 years. And then the number of medications. So there's usually 4 different medications that you have to take. They have side effects and it just gets to be inconvenient. The medication side effects, so ethambutol causes optic neuritis. So ethyl alcohol is the ethambutol is similar. Optic neuritis, that's just a blindness in the optic nerve. Isoniazid's tough on the liver. And so especially if somebody's an alcoholic or has already got liver damage, they're going to end up with hepatitis. Peripheral neuropathy, and peripheral neuropathy, that's just peripheral means as far away from central. So when you talk about peripheral vision, that's the vision, like if you're looking straight ahead, what can you see that's all the way on the side of your head without turning your head, your peripheral vision? Well, in your body, peripheral nerves, those are the nerves in your feet and your toes. They're the nerves in your fingertips. Then pyridoxine is a vitamin B, and they have found supplementing the vitamin B, it's going to help minimize or prevent that. Pyrazinamide can cause nausea and vomiting or hepatotoxicity. Keep in mind, remember that a great number of patients that had tuberculosis, they're alcoholic. Alcoholics have already done significant damage to their liver, and a lot of times the alcoholics continue drinking alcohol when they're taking. So when they do this, the pyrazinamide and the isoniazid, they're a much more significant burden on the liver, and they can cause serious liver damage. Rifampin, it turns your urine orange, your tears orange, your sweat and other body fluids orange. And then rifapentine, it's just kind of like a baby version of rifampin, but it does the same thing. So what are some factors to consider when treating multi-drug resistant? It's difficult to treat, but the long duration of treatment. So the most important thing you're going to find even with patients when you have a medication that has side effects, or whenever there's an expectation of a medicine that either has to be taken chronically, continuously, and it's critical to take at a specific intervals, it's extremely important to relate that information to the patient. When the patient's informed, there's a greater likelihood they're going to be compliant. Even ahead of time, if you're a patient, you come to the pharmacy, you get a prescription, and I tell you from the start, this medicine, it's going to be helpful, but only if you take it for 2 years. If you take it for 1 year and stop, you're actually going to end up worse than if you never took it. If you go home, you might not be happy about it, but you're going to be more likely to think, well, I guess I do want to get better, so I'm going to take it the whole course of therapy. Same thing with side effects. Augmentin is an antibiotic, and it's not a matter of if, it's a matter of when it's going to cause diarrhea. So with patients, it's critical that we tell them this medicine is going to cause diarrhea. In children and infants, it can happen in 1 day or 2 days. if somebody goes home and takes an antibiotic and has a horrible bout of diarrhea, they're just going to, they think they have a side effect or a bad reaction, they just stop taking it. If they go home and they know they have been warned that it's going to happen, they're more prepared, and then they're more likely to be able to deal with it and continue taking the drug. Now we're dealing with the common cold, cough, and allergy. So the common cold is a self-limiting viral infection. Mild malaise, that word again, malaise just means you feel bad all over. Runny nose, sneezing, scratchy throat, fever. And then the complications, well, when you have a lot of sinus drainage and sinus, it remains you have 8 cavities in your sinuses right behind your eye sockets and behind your nose, your nostrils. Whenever there's mucus that just collects there and sits there for any length of time, well, that mucus is a perfect growing medium for bacterial infections. So when you get an infection, it leads to inflammation, and so you end up with a bacterial infection that's in the sinuses. Otitis media is an ear infection. Antibiotics. So the common cold is a virus, and so we don't have an antiviral to kill the cold. However, when somebody does get a cold, it's going to predispose them to getting sinusitis or an ear infection. So the antibiotics that are used when somebody has a cold, that's treating the complications that are bacterial. Allergies, that's a state of hypersensitivity introduced by exposure to an antigen. So what's an antigen? An antigen can be any number of things, but an antigen, the most basic definition, is that it triggers an allergic response. Main symptoms, runny nose, itchy eyes. What's the self-treatment of colds? Well, antitussive. So what's an antitussive? Antitussive is a cough suppressant. Then an expectorant. What's an expectorant? Well, that's something that helps thin your mucus so you can have a productive cough. Decongestants. So decongestants, what you take whenever you're congested, like whenever you can't breathe and you're talking through your nose and it's just so congested. A decongestant helps to open up, it constricts vessels and helps drain the mucus to help relieve some of that congestion. Antihistamines work a couple of different ways. One, they block the histamine release of the different messengers and things that are responsible for some of the most frustrating symptoms you have when you're experiencing a cold or allergies. But the older, especially the older antihistamines like Benadryl, they're also drying agents, so they're excellent at helping drying the mucus if you're having a whole lot of mucus production. What's the role of the pharmacy technician? Well, as a technician, the most common first thing is if somebody says, like, where's the NyQuil? Well, you need to know, where is the cough and cold medicines? Where's the cough and cold medicines that are used for the children? Where's the cough and cold medicine tablets? Where is the Zyac or the emergency? So knowing that department, you can really assist the pharmacist and the patients. The other thing is, as a technician, you cannot give advice, you can't make a recommendation. However, you can read a patient anything that appears on the packaging label of the box container or label of the medication. So it's absolutely legal and perfect for you to read to them. And there's a lot of elderly that either because they don't have their reading glasses or one reason or another, that they benefit from you being able to read and explain the instructions. How do you prevent colds? Well, frequent hand washing. And we've learned by hand washing, we're talking about you scrub your hands with soap and water, warm water for 20 seconds. That's with soap. And then you rinse for 10 seconds. So I think they say you sing happy birthday to you twice, and that comes out to be about 30 seconds. You turn your head when you sneeze or you cough into your elbow. You try not to touch your eyes or nose after touching anything, and you want to regularly wipe your phones with disinfectant. Antitussives, these are cough suppressants. So whenever you'll see these mostly used, like if somebody is trying to go to sleep and they can't sleep because they just keep coughing. And they're coughing and the cough can be so harsh that it's painful, especially in young children. Well, we've got narcotics. The narcotic opiate derivatives, they are powerful antitussives, but they're also they have the high potential for addiction. Now you'll notice codeine. Codeine is one of the best, most powerful cough suppressants we have. That's why we have so many cough medications that have codeine in them. What's the schedule for a cough syrup with codeine? It's going to be a Schedule 5. So all the cough syrups that have codeine, they're Schedule 5. Hydrocodone, anything that has hydrocodone as an ingredient is a Schedule 2. There's one medicine called Tussion X, and you take a teaspoon every 12 hours. It tastes like butterscotch. It's delicious, and it's very good. But doctors don't write for it as much anymore now that it's a C2. Then we have Tessalon pearls. These are little golden pearls, and they look almost like vitamin E capsules. They're golden. They're kind of clear with clear content. And the way you take them, it's interesting. It's poorly understood how they work, but it comes in 100 milligram and 200 milligram. When you take them, it's very important to drink a lot of water. Most people don't have any side effects, but some people do report it makes them sleepy or dizzy. Because of that, we put a sticker on the bottle when we fill it. It may cause dizziness or drowsiness. Use caution operating heavy machinery, no alcohol. Now, the safest non-narcotic, over-the-counter, most powerful antitussive is dextromethorphan. And dextromethorphan, you're going to see cough lozenges, cough drops that have dextromethorphan. There's a product called Delsym. Delsym comes as a suspension, and it's a sustained release, a 12-hour dextromethorphan. Now, what happened is kids discovered if you drink enough, if you ingest enough dextromethorphan, you'll experience hallucinations. The biggest problem is that the only thing that really provides dextromethorphan by itself, where you can ingest a large quantity, is Delsym. Delsym is a sustained release product that lasts 12 hours. So what happens is these young kids will buy a bottle, they'll guzzle it. 2 hours later, they don't feel anything, and so they'll get another bottle and guzzle it. Well, by the time it does start working, then they're going to be having horrific or just profound hallucinations that are going to last 12 hours. So dextromethorphan, you have to be over 18 years old to purchase it. It is available just right out in front. You can get it at the grocery store, but it's one of those medicines that is going to ask for an ID. So this is what the Delsym looks like, and as I mentioned, it's 12-hour cough relief. Now, Robitussin DM. Robitussin DM has 2 ingredients. Robitussin is guaifenesin. It's an expectorant. The DM is the dextromethorphan. It's a cough suppressant. So why would you take something to help you have a productive cough and then also take something to help prevent a cough? And what this has to do with is the dextromethorphan is there. That's to help whenever you're coughing and it hurts. You're coughing, and when you do cough, it's painful, or when you're coughing, it's keeping you from sleeping. And so it actually works by stimulating the receptor in the brain that triggers the cough reflex, and so it shuts it off. The expectorant, that's just to help whenever you have so much mucus being drained. When you do cough, it helps thin that mucus and helps you have a productive cough. So the expectorant, guaifenesin. So Robitussin, you can buy just plain Robitussin, it's guaifenesin. You can buy plain Mucinex, it's guaifenesin. You can buy Robitussin gel caps, guaifenesin. It loosens your mucus, thins bronchial secretions to make coughs more productive. Now Mucinex, there's a Mucinex D. A Mucinex D is the expectorant with D, the decongestant Sudafed. There's a Mucinex DM, which is the expectorant with dextromethorphan. And there's a Robitussin DM, so it's the Robitussin with the dextromethorphan. Our decongestants, Sudafed. Now, Sudafed, we have a program called Myth Check, and that's because in the late 1980s, we had an epidemic of methamphetamine, crystal methamphetamine addiction and abuse across the nation. It literally wiped out communities. And one of the things they discovered immediately was that Sudafed, it's very easily made into methamphetamine. And it's unbelievable, but even in the year 2000, I was working at Target, and we just constantly, we hired 2 security people just to stand near the pharmacy at all times because what would happen is people would come in with a basket. They would just push everything off the shelf into the basket, race out of the store with the basket into a pickup truck and drive off. And they didn't care if it was just plain Sudafed or if it was a mixture, if it was a drug that had Sudafed in it, because they weren't the ones using the final product. As long as it had Sudafed as an ingredient, they were able to make it and sell it as crystal meth. Nowadays, the pseudoephedrine, you have to keep it. It's kept behind the counter. Person has to be over 18. They have to provide you with a government ID. So it doesn't matter what state you're in. If you buy Sudafed, there's a national database, and they'll scan your ID, and they're going to be able to see when you last purchased it. You're limited to how much you can purchase a month. So you can only purchase it at the pharmacy register. You have to come inside. You can't go to the drive-thru. You have to have a photo ID. You have to be over 18, and then there's even a limit on how much you can purchase each month. Phenylephrine. So whenever you see the decongestants out in front of the store, they've got phenylephrine. It's impossible to make phenylephrine into methamphetamine. So it's replaced Sudafed in a whole lot of products. There's no special requirements about phenylephrine, and it's even available in eye drops and nasal sprays. The problem is it's worthless. You might as well just not take anything. It's just the results on it. They've demonstrated that phenylephrine, it's a minimal value. Now, something that's real important to notice about decongestant nasal sprays. These are nasal sprays that when you squirt directly into the nose, they cause immediate vasoconstriction right there where you have your 8 sinus cavities. And guess what? They work miraculously. If somebody's got congestion, nasal congestion in their sinuses, and they use one of these sprays, they're going to have sudden and immediate relief. The problem is if you use these sprays more than 3 days in a row, you develop a condition called rhinitis medicamentosa, or rebound rhinitis. And what that means is if you use these sprays more than 3 to 5 days, your body becomes addicted to the point where if you don't use it, you're more congested than you were to begin with. You can barely breathe. There's a lot of times, there's even Kristen Bell, this actress, and she went to drug rehab because she was using cocaine, but she was on Ellen DeGeneres, and she's like, oh, I guess I'm just going to share it with my public. I got addicted to nasal spray. It's like, right, but it can happen, but that wasn't what happened to her. So the decongestants are sympathomimetics that cause vasoconstriction. The word mimetic just means to imitate. And sympatho, that's the sympathomimetic amines, that's just like epinephrine and adrenaline. And so some of their side effects are going to cause the heart to race, they're going to raise blood pressure. But you can see all these different Sudafeds. The Sudafeds, that's the pseudoephedrine that's converted to crystal methamphetamine. So it's the CMA, the Combat Methamphetamine Epidemic Act. You remember him, Walter White? Because Sudafed's easily converted to crystal meth, this act was implemented. There's a maximum you can purchase monthly. It's only available at the licensed pharmacy. There's a signature log, and they scan your ID. There's a national database, and so it checks to see. So if you go from one state to another, and there's even a term called smurfing. That's where somebody will pay several people to use their IDs, go in and buy Sudafed and bring it right back out, and then they get their Sudafed. Antihistamines, the first generation, well, they're called first generation. Why? Because they were discovered first. So we got Benadryl, diphenhydramine, chlorpheniramine, chlorpheniramine. And these, the way they work, they just stimulate the histamine 1 receptors. Main side effects, so they work great. These work very well against stopping the allergic reaction. Main side effect is drowsiness. Another side effect, though, is it has a very strong drying effect, but that's a good thing. If you're making a whole lot of mucus and you're miserable, that's a good thing. You want to stop it. So here we got Benadryl, diphenhydramine. Now, Claritin and Zyrtec, these are second generation, or these are non-sedating antihistamines. The second generation antihistamines, they're non-sedating. Now, Astelin has some CNS effect, But the other ones, so Pataday, Clarinex, Claritin, Clarinex, when you take Clarinex or Claritin, when you take Claritin and it goes through the liver, it's converted into Clarinex. Cetirizine, there's Cetirizine. So Zyrtec is a brand name, and then they have Zizzle. All the drug company did was, when they lost their patent, they just came out with a prodrug. It has a potential for drowsiness, but the reason these do not cause the drowsiness that's associated with the first generation is they do not cross the blood-brain barrier. So these are very safe medicines. They're very safe to use in children, very young infants. So I've seen them use them even 6 months old, the liquids. But the thing about the non-sedating antihistamines, they're most effective if you're taking them every day prophylactically. So if somebody has allergies, they just need to take it every day as a preventative measure. Once you already have an allergy triggered, once you already have your runny nose, sneezing, watery, itchy eyes, these don't work very well at all. You need the older antihistamines. Then we got nasal corticosteroids. And what happened, these used to be prescription only. There's minimal absorption, so it doesn't get into the bloodstream, so you don't have the same problems that you have with regular steroids. The thing is, remember, with the nasal decongestant sprays, they have that serious, horrible side effect if you use it more than 3 to 5 days of rebound sinusitis. And so the government, they just said, we've got to do something. There's just too many people. When I worked in pharmacy, people would come in and buy boxes of 12 Afrin. They would want to come in and buy 4 cases of 12 Afrin at a time. And it was just really sad to see. And you knew what the situation was. It was just that if they didn't use them, they weren't able to breathe. And so the solution, though, was these nasal corticosteroids, because the corticosteroids, they're very effective. They reduce the inflammation, and it's the inflammation really and the vasoconstriction that are responsible for keeping the mucus from draining properly. So if you're using a nasal corticosteroid, it's going to help maintain or prevent the inflammation, and that preventing the inflammation is going to stimulate the normalized drainage of the sinuses, and so that works very, very well to prevent the sinus congestion. So these, when they were prescription, they cost about $120 just for a spray that lasted 1 month. Now you can get them for about $10, $10 to $15 for a month worth, identical product by the same company. And just here's some examples. So Nasacort is triamcinolone. See this right here? This is like a meter dose inhaler that you'd spray in your mouth, except for this one's for a nostril. And then this is just like the brand name. This is a generic Nasacort. So how do expectorants such as guaifenesin work? It loosens up mucus. It thins bronchial secretion. It makes your cough more productive, so it makes it easier for the body to cough up the excess mucus. What is a natural expectorant? Water. So if you ever find yourself just choking to death on your mucus and you're needing some kind of expectorant and you're not up to going to the store, just drink plenty of water. On the other hand, let's say that you do have your guaifenesin. If you want to drink plenty of water. So it's something we always recommend when somebody's using Mucinex or Robitussin, guaifenesin. It's going to be much more effective if they drink by increasing their water intake. Complementary and alternative medicines. These are the medications that are over in they're in the vitamin section. They're like the herbs and the supplements. And frankly, some of these are just as effective as medications. We have Boswellia serrata, which is used to treat chronic inflammatory diseases such as asthma, and it comes as a powdered form, and they also have it available as a tea. Choline is just related to the B vitamins, and it's used to help manage asthma. Yoga it's just a mind over matter, and it's used to strengthen your ability to breathe, relax, and control your respiration. And then finally, there's nasal irrigation. Now, there was a scandal about 3 years ago because it's very important if you use these nasal irrigation systems. The way it works There's one thing that you plug in one nostril and you just blast water all the way through. It goes into your sinuses. You have those 8 sinus cavities. And if you blast with enough pressure, theoretically, it's supposed to just kind of clean away, wash away eosinophils and any debris, anything that just shouldn't be sticking around in your sinuses. And then it comes out the other nostril. And so they had a device that had one thing that you plug in one nostril, and then it had like a vacuum out the other nostril. The only problem was there were some people that were using tap water instead of buying sterilized water. And then they ended up getting meningitis. So meningitis is inflammation of the meninges of the brain. That's when you get an infection in the brain. How would you get an infection in the brain? Well, that's whenever you're blasting infectious material right up into your sinus cavities, which is very close to your brain. I saw a new one just recently on TV that looked pretty interesting. You know, if it works as well as it looked like it works, I think I might try it. And then finally, these right here, these are homeopathic products. And the way homeopathic products work, they will take something like something that will irritate your sinuses. And they'll take one molecule and they'll put it in a barrel of water. And then from that barrel of water, they'll take a drop and then they'll put it like in a swimming pool of water. And then from that swimming pool of water, they'll take a drop and then they'll put it like in a lake. Then they'll scoop some up and put it in a bottle and sell it. And the thinking is if your body is exposed to just this 1 bazillionth of a tiny fraction of a molecule of something that causes a problem, where your body's own immune system and reaction will respond in such a way that whenever you're exposed to the real thing, you're already protected, kind of like a vaccine. But these are worthless. They've never been proven effective. And the one reason that you're going to find pharmacists are so against these, this one product right here, earache relief. Well, there's a pharmacy magazine called Pharmacy Times, and every year they have, it's a great big deal because they have over 100,000 pharmacists, and they'll have a list, and this list has drugs from every single category of medicines that you can buy without a prescription. And then they'll have this survey over a month period, but then 2 months later they publish it, and then they'll say like 99% of pharmacists recommend Mucinex as the expectorant. 99% of well, every year it'll say 100% of pharmacists recommend earache relief by Similacin. Guess what? In the earache relief, there was one item listed, no options, and it didn't even have a checkbox. It was just automatic. So just by default, anybody who entered the survey gave their vote to this earache relief. It did not provide relief. And so if you've ever had a child that's had an ear infection, or the day that you deal with a parent whose child is suffering in extreme pain, you'd be very angry at a company that's just taken full advantage of a misleading advertisement to promote a product. So anyhow, these, the Similacin, now I don't mean to offend anybody, but these are homeopathic, and you can go Google it, look it up, but what it is they dilute, they take a fraction of a fraction of a fraction of a fraction, and it's called similar syllabus, which means the thinking is something that causes a condition. If you expose a body to it at a microscopic level, the body's going to have a reaction that's going to mount and be prepared so that it will have a profound effect in giving relief. But there's nothing scientifically, there's no documented evidence of the effectiveness. So listen, guys, you have a wonderful afternoon. You just got one assignment after you have your drug test today that you had to take, and then there's a couple of Navigator Plus assignments to do, and you'll be done for the day. So have a wonderful afternoon. Oh, summary-wise, asthma, it's reversible. So you're going to you'll hear about children who have asthma, and then they grow out of it. Drug therapy is the mainstay, so it's not like you can avoid. COPD is irreversible. and it's progressive. The pharmacological management of bronchitis and emphysema, it's empirical. That just means the doctors, they just based on the person's presentation and based on what's common in practice. Antitussives, expectorants, decongestants, and histamines are used in the treatment of cough, cold, and allergy. And then we have nicotine cessation products that are OTC. We have two. There's one called Chantix. It's prescription only. And there's a lot of controversy with it because there's a high risk of suicide attempt after using it. There's another one called Zyban, and all it is Wellbutrin or bupropion. It's an antidepressant drug. And there was a period of time when a lot of people using bupropion said, I don't feel like the need to want to smoke as much as I did beforehand. So then the company came out and they got FDA approval. So they just created a new name called Zyban, and they use Zyban as a smoking cessation product. It's prescription only as well. But the most effective means of smoking cessation is just cold turkey. Because you're going to find there's an epidemic of people that just change one addiction for the other. For example, if they chew tobacco or smoke cigarettes, well, now they just chew gum. Or they might just be using the vape instead of the cigarette. But and those, of course, they're not the vaporite. Vape isn't introducing all the same harsh chemicals. Listen, have a great afternoon, guys. Thank you for your time. This is a long and really thrilling presentation. Have a good afternoon.